Farming Fit is a project that launched in 2024. It brings together the statutory and the third sector to engage with the farming community and improve health outcomes. It's very important that this community was targeted because traditionally they may feel isolated, they might find it difficult to access services. So by us going out, we can engage with them to build relationships, to build trust. We sit at their tables, we can have a chat, and then we can lead the conversation around to health topics. We can talk about screening, we can talk about the value of immunisation and vaccination, help people to understand why they do the things they do, and give them the tools to make changes. It brings together Powys County Council, Powys Teaching Health Board, and the third sector such as PAVO. So we aim to go out with a small team. We set up in the livestock markets, but we also visit agricultural shows where we can raise awareness of health and well-being. We can identify ways that people can get support, and along with a health check, we can signpost people to services that might best meet their needs on an individual basis.
Making every contact count is about empowering people to make decisions based off of what they believe. So we're giving them the tools to make those decisions. The last thing people need is to be told how they should be based on a rule book. Everybody's different. And if you're going in making a conversation count by telling people how they should be, you're going to lose that contact. So what we're doing and what MEC is about is coming to these farmers markets, engaging with everyday farmers that might not necessarily be able to have those conversations. They might not know about healthy eating or the Eat Well guide. They might not know about alcohol units and knowing that 14 sort of is your limit. They might not know about the dangers around smoking. So what we're here for is just to highlight all of those different things, and then people can make the decisions that best suits their lifestyle.
Just a lot of the time I don't go to the doctors often enough. They mostly say, oh, when I do go there, well, you don't come very often. So, so perhaps it's a good thing to have this year, that because I'd be just a typical farmer, like a builder as well. Like a lot of people, manual workers, I'll be all right. Yeah, don't worry about it. Yeah, I'll be all right.
Well, I think it's because our stock are our priority, and we care for them and monitor their condition. If we see that they're not well, we attend to them, whereas with our own health we sometimes neglect the symptoms and don't necessarily address the problems in good time to have a positive outcome. What convenience, because if you have to make an appointment to have it done in a surgery, it takes time, of which there isn't too much spare time on farms these days. Labour's scarce, there's plenty to do. So coming here this morning and seeing the opportunity present itself on a plate, one couldn't resist having all the tests and thankfully having the all clear. Well, I mean, without a doubt, I mean, the chances are that the people that have had tests today wouldn't have bothered maybe for months, years, or until they had some pretty serious symptoms which could have been prevented had they had a test sooner. And as I say, it was there in front of us. Tuesday morning here in the market, it's a social for many of us as we get older. But it was a reminder that we also need to look after ourselves, and that's why I engaged with you this morning and requested a test, which, as I say, I'm pleased to say the results are positive. So I feel like a new man.
I think it's very important to support this because a lot of farmers are very quiet sort of people, very busy people who wouldn't necessarily go and see about their health, but when they're in the market they sort of got no option, and they're there to see them and sort any problems out for them. A lot of the farmers give very positive feedback with it really. Again, the time aspect of health checks and whatever they didn't really like, but when it was on hand they were happy to do it and happy to receive the feedback. I think for one or two people things have been spotted early enough so it can be treated. And again, just being there for the people, and that time element of it was just absolutely fantastic. There was no time lost with any farmers going to any doctors. It was there on hand, ready to go.
Farming Fit started as an origin of an idea from the Powys Agri Welfare Support Group. We've been pushing to support mental health in the farming community for many years. By working together with Powys County Council and the vision of people within there and Powys Teaching Health Board, we were able to come together and put together a programme of health checks utilising the Council, the Health Board, PAVO and the third sector organisations who've been able to contribute to everything that is taking place in the last 12 months. It's been a fantastic opportunity for the community to gain the trust of the organisations and have been really accepted by the farming community as something so important that it's become word of mouth and the knowledge has grown across Powys and is so positively received by everybody across the county and is being recognised outside as well. It's great to be part of an organisation that just works together. The partnership has just been the strength of everything that we've done. And it's lovely to see everybody come together and celebrate what is going on in terms of supporting the community.